My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I'm here with Dr. Len Tau, who is known as the Reputation Doctor. And we're talking about all things reputation today, and more importantly, reputation marketing. And Dr. Tau he's a prolific speaker at dental conferences across the country. I've heard him speak. He's amazing. And he's also a consultant who helps doctors and practices all over the country build an online reputation where patients will look at it and then they would want to come and see you. So I really, in this segment, my question to you is, what's the strategy? How do you get good reviews?
So I think the most important thing that practices focus on is starting with a reputation marketing plan, starting with making your practice a reputation culture. When you realize that you're being watched by your patients and they're basically going home and grading you, which is really, they're not taking a survey, they're just writing like a report about you online, that's the way you start. If you decide you're going to focus on that, you can then become a reputation marketing practice. Sure. So number one is you have to ask. If you don't ask your patients in one way or another, they're not just going to do the review.
Correct.
Patients in general don't take that step without being prompted in one way or another.
Correct.
So if you ask patients, good luck. You ask 100 patients, 3-4 patients may do it.
Correct.
Okay, so that's the first thing you got to do. You got to ask. You can try that strategy for a while. You're going to realize it's not going to work. You can hand them a card, put them in their hygiene bag. They're not going to do that either. So what we find is the most effective way is by using an automated platform to send out a text. Email is not very effective anymore.
Okay.
Email open rates are really low. What I like to do during my sessions is to have my attendees take out their cell phones, and I ask, how many people raise your hand, how many unopened emails do you have? And literally it's in the hundreds of thousands of sometimes that have people have unopened emails. When they say how many unread text messages you have, most people have 0 unread text messages.
Correct.
So the fact is we want to send a text message to the patients after the appointment. It's signaled from the practice management software. So when the patients leave the practice, we know that the patient has left the practice, and they receive a text message asking for feedback about their experience. So that's the signal, is when they've left the practice, we know they've left. We look at the name of the patient, the email address, the cell phone number, and the last visit date. So we also prevent it going out as often as some other systems do. We want it to go out one time within a 30-day period.
So you kind of, the workflow is patient comes in, gets an amazing experience, hopefully. They leave the practice and automated reminder goes out via text, hopefully, because emails you said not effective, for them to then post a review to what kind of, is it Google or is something else as well? So
the way our product works is the text message is sent out. When they click through the text message, and then the verbiage I like to use to the patient is, thanks for coming in today.
Sure.
We hope you had a great experience.
Sure.
Just so you know, you may be receiving a text message asking for feedback about your experience, and we look forward to reading what you have to say. So that's the way that you kind of present it to the patient. When they click on the message, it says, and this is usually customizable, but I like to use, we hope you had a great experience and want to leave us a positive review. However, if there was something that did occur that you would like to discuss with us personally, please hit the Contact Us Below button. And there's links that are green, that are positive. Go to usually Google and Facebook.
That's great.
And negative is a big button that says Contact Us Directly. And when you hit the Contact Us Directly button, it says, we apologize that your experience did not meet your expectations. Please tell us how we can improve. And then mine says, if it's an urgent matter, please contact me via my cell phone number, or my cell phone number is there. So I've had people contact me, they write direct feedback it is, like I waited too long, or any of these issues, or they contact me on my cell phone and they say, hey, I had an issue in my office. They want to contact me that way.
And that's a great way to potentially, convert a bad to a good experience.
Yeah, it turns your critics into your biggest fans.
That's very nice. So in terms of, if you do end up getting a bad review, you can go back and basically try to call the patient and fix it.
Yeah, and that's what I do. Whenever I get anything that I feel is a severe concern that needs to be dealt with, I do message the patient back, or I call them on the phone and fix the problem.
And what about at times when you're in the automated system, can you select the patients that are getting that? Because if you know that there's these 10 patients who absolutely love the experience, they'll definitely get the text message. But if there is some that you don't, can you pre-select that?
Yeah, you can turn patients off. So if you know someone had a bad experience or they left in a huff, you can, before the end of the day, you can actually deselect them from receiving the text message, so they will not get a text after the appointment. But remember, if patients are leaving your practice, they're going to go to Google anyway on their own. They don't need a piece of software to write a negative review. And the point of our software then is to send as much text messages out to patients to overwhelm the negative feedback. We're not going to prevent negative feedback in general because patients go online and write negative reviews. It happens.
And to that point, the good reviews have to be real, right? It can be your family member or your entire family giving you all this.
No, you want a mix of those. You want to get them from your patients that are in your practice. You don't want to get them from family members. You don't want to get them from employees. You don't want to pay somebody on the outside like Fiverr to write fake reviews. They have to be real reviews from your patients who are in your practice.
And isn't there something, it's not a best practice according to Google at least, right? To kind of give them a discount or a coupon or a Starbucks card to get a good review?
For Google and Yelp specifically, you cannot incentivize a patient. You cannot give them a discount. You can't give them a coupon. You can't give them any type of financial incentive, a whitening pen. You cannot do any of these things. Technically, one of the gray areas is a raffle. So, hey, you give a review, we enter you into a raffle. That's one of those gray areas.
Right.
So no incentive at all. In fact, for Yelp, Yelp has elite Yelpers, people who are very active on Yelp. They're actually given an incentive by Yelp to actually rat the dentist out, and Yelp releases a blog post like every month, like these were the businesses that actually violated these terms and conditions.
So the bottom line is you've got to ask, if you need a good review, ask them, then preferably send them a text through an automated system, have some sort of filter so that you can filter the potentially good ones, but again, the bad ones are going to get there anyway, and then but most importantly, what I heard at the beginning of this segment was establish a reputation culture. And that's what drives everybody in your team to kind of seek those reviews and provide a great experience to the patient, because you know that culture of reputation is going to help the entire practice.
Yeah, 100%. So I do want to clarify one thing. One of the things that you're not allowed to do is called review gating, which is asking a question like thumbs up or thumbs down, or did you have a great experience, yes or no. That's called review gating. You can't gate reviews. Oh. So we have red button a green button and a red button in the same question, right. And that's not gating. So that's what's allowed within Google's parameters. If you have a separate question like thumbs up, thumbs down, which goes in two different directions, right. That's a gated review. You cannot review gate anymore. That was stopped as of April 12th of 2018.
That's a great point, but I'm excited. I think this is amazing information for our clients and dentistry overall about how to get good reviews. So I look forward to having more discussions about this topic. Thank you so much.
Thanks, Mo.